And action. Joel had a question about vitamins. In a nutshell, I have done videos in the past. If you YouTube search DrRic tutorial vitamin, I think a couple of different things pop up. DrRic tutorial vitamins for kids, how to choose a multivitamin, taking a vitamin. There's a couple of different things. Vitamins for anxiety. So there is that overarching statement that says, yes, average person usually needs to take something. If you're an athlete, I think you should take over and above what an average person takes as far as food and nutrition, because you should always use food and nutrition as your first source of medicine or vitamin. When the food is lacking or limited, then you take that supplement. When you have a deficiency on blood testing, then you take that supplement. Sometimes just throwing a wide net out, especially for those of you who don't have the option to get expensive blood testing, you can make an educated guess. My educated guess for the majority of people I see in Chicago and probably across the nation, number one, vitamin D is low. Number two, you're probably taking in your diet too many omega-6s, not enough omega-3s. Number three, I think that B12 and magnesium and iron, if you're a menstruating female, are a little on the low side. So I'd say do it. In particular, as far as disease processes are going, when you have arthritis, glucosamine sulfate. When you have pains or inflammation, turmeric. When you have problems with getting to sleep, 5-HTP, melatonin, SAMe. When you have anxiety. So the list goes on and on. Those are actually getting to the problem when you're having a deficiency, more than a deficiency, but a disease process and symptoms. So I had a wide range of different things that I would do before getting to the prescriptions. I use prescription medicines for my patients. I don't take anything, knock on wood, just yet. Hopefully I can avoid that till I'm old and gray, although I'm a little gray already, so, and I am a little old, oh boy. So the idea would be, if you can maintain a healthy lifestyle, then that's cool. You can avoid the medicines, but usually healthy lifestyle includes making every part of your nutritional practice good enough for all the cells to rebuild, replace, and continue existing. So white blood cells, they need a good basic building blocks in the form of nutrition to work their magic. Enzymes, hormones in the body, digestive enzymes, all need basic building blocks. And when you're lacking a couple things, whether it's iron if you're a menstruating female, or B12 if you are a vegetarian, or if you're on proton pump inhibitors like Nexium, Omeprazole, Prilosec, Protonix, all those things cause your B12 to be deficient, as you've seen in my DrRic tutorial GERD video. But again, a lot of people have symptoms. A lot of people take over-the-counter medicines. A lot of people take prescription medicines. For those of you who take that stuff, there are deficiencies caused by prescription medicines. I suggest another fellow from the Arizona Center for Integrative Medicine developed a website called MyTavin, M-Y-T-A-V-I-N. If you check out his website, it's fantastic. MyTavin is actually just an application, but if you plug in your medicine, he has loaded it up with all the deficiencies in vitamins that are caused by that prescription medicine. So if you're on a medicine, like a proton pump inhibitor I just mentioned, then you should check it out, but you should be on at least B12 and a couple of other things. So know the side effects of the medicines you're taking. Know the side effects or deficiencies in the average food groups that you're eating. Know what your family and your symptoms and your disease process might be pointing to as far as a deficiency. You don't have to get expensive blood tests to know. And by the way, those of you who have compromised insurance and a high deductible, you don't have to get all these fancy blood tests. I think it's nice to get a snapshot before you start on your diet or lifestyle change. Then if you don't feel anything, but yeah, you're curious about whether it's working, you get a second snapshot and an interval of time 4 to 6 months later to see if what you're taking is actually getting in. And that's the other thing. Because vitamins are over the counter, they're very loosely regulated by the FDA. And sometimes you're going to be trusting the brand or the vitamin company to be producing top-notch stuff. That does not always happen. If you check out my video on how to choose a multivitamin, I think that it's the one that I do in front of a big screen, and I link to how to use Consumer Labs. Great independent website where they test a lot of brand names out there. And they also called them to their carpet as far as whether they found adulterants. My favorite turmeric, I didn't realize this till a patient came in. My favorite turmeric is Gaia brand Turmeric Supreme. Unfortunately, they got called to the carpet because there were adulterants in with the turmeric. And it's like, oh man, this is what I've been relying on. So until they fix that, I'm sure they will, the company, I mean, I'd have to look for it. But thanks, Bill, for taking care of that for me, or at least alarming me. So the average, again, the question, do I need to take a vitamin? Do you need to take a vitamin? Yes. At the least. Multivitamins, probably good enough. I don't like the binders in multivitamins, but if you're looking for a one-stop shop, it's okay. To have water-soluble and fat-soluble vitamins together, you have to have binding things or chemicals that keep everything stable, and to have one, in addition, let's say one mineral like zinc, and right next to copper, right next to magnesium, right next to, so you have all these things together. You got to make sure they all get in, because usually if you take them individually, they'll combine and beat each other up for space to get into the lining of the stomach. So you got to be careful about what you take. That's why, for example, if you're on minocycline for acne or Lyme disease, doxycycline, you cannot take that with milk, calcium, magnesium, because it'll bind, it'll compete and bind and then either neutralize and get it out so you don't get any medicines, or it'll cause terrible side effects. So again, ask your pharmacist, know the side effects to your medicines, know what you can and cannot take. Iodine and thyroid, you got to be careful with. I've done a video on this. They don't really bind each other out, but you can cause a hyperthyroid response when you first introduce iodine to a very level system that's used to a certain thyroid dose. So it's not just popping in a vitamin nowadays. Nowadays, there's a lot of vitamins that are out there, a lot of medicines that we're using, and a lot of deficiencies. So you do have to be on something. If you want to be choosy, get some blood tests. If you can't afford the blood test, just get on a multivitamin with vitamin D. I like 5,000 international units a day, unless you're a kid, maybe 2,000. And maybe an omega-3 oil source, whether it's flax, fish oil, or krill. It's up to you. But I have a video on that, DrRic tutorial, omega-3 oil. But those are the basic three. And then as you get older, or as you have disease processes start to take hold and you become symptomatic, then you find an integrated medicine specialist or a naturopath, and you kind of get a little bit technical with what else you're going to be adding to your plethora of pills in the morning and your plethora of pills in the evening. So good question, Joel. Hopefully this helps you with kind of deciding as far as where to go. I have a video on that. But for now, just go cheap. Just get used to the habit. That's why I suggest with a lot of younger kids, just get used to the habit of taking something every morning at the breakfast table. So when you get older, it'll be like, oh, this is common sense. I take something every morning, like we all do. At least all my healthy people do. So as far as the supplements that I take, office is closed. These are after hours. But this is the plethora of stuff that I use. Most of this stuff, this is whole food part, that's the fish. Most of this stuff is mine. I did have some patients bring in their discoveries as far as saving money. This is one of the fish oils that I picked up. Tasted terrible, smelly burps, but was cheaper than my other stuff, Carlson brand. And then patients also brought in when they found that certain capsules had good results and the right amount of omega-3, total omega-3. This is the turmeric that I now get, but I'm still missing that old stuff that I used to rely on. So that is what I take. I don't know how long that will... I accumulate a lot of vitamins, but again, I use it because I do have true deficiency, and I consider myself a 54 going on 55-year-old athlete, so I gotta take that stuff to push the envelope. That stuff helps me sleep better. That stuff helps me exercise more aggressively, recover faster. I have tried a couple weeks without, a couple months when I was trying to go lean on buying so much expensive stuff, and I noticed a difference. So to me, subjectively, whether that's placebo or not, it helped. If I can afford it, thank God. So far I can afford it. Thank God, so far my health is pretty decent. I got to work at this. It ain't easy, and it's still evolving. I'm sure as I hit 60, that stuff's going to change. Maybe I'll have to be on a medicine. That's if I can get a doctor to take care of me. So a good question, Joel.